Hello and welcome to the program. I'm your host, Neal Howard, here on Health Professional Radio. Thank you for joining us today. October is Eczema Awareness Month, and in studio with us today is Dr. Doris Day. She's a board-certified dermatologist, and she's here to talk with us about atopic dermatitis. Welcome to Health Professional Radio, Dr. Day.
Great. Thank you for having me.
Tell us a little bit about your background, how you got into dermatology. Was that your focus from the very beginning of your medical career?
Well, actually, I started out as a medical journalist, and that was my first career. And as I studied and worked as a journalist, it was in the early mid-'80s, and HIV was a relatively new disease. And one of the early findings was something called Kaposi sarcoma, which was a skin condition. So I covered a lot of dermatology meetings where we talked about, and I learned more about the skin through learning about Kaposi sarcoma. So by the time I got to med school, I already knew so much about dermatology when most of my colleagues just saw it as like a couple of easy questions on the exam that they didn't need to pay attention to. So my level of interest was already raised. And I did internal medicine before I did dermatology. I understood that the skin really is a powerful reflection of your overall health and well-being, and that I could tell so much about the patient beyond the skin by understanding the skin itself. And that's why it's my passion. The skin is such an interesting organ, and it is really a great way to help somebody stay as healthy as possible for as long as possible.
You know, I've one of my daughters is 16, and I can remember her coming home from elementary school saying, "Dad, you know, we learned that the skin is the largest organ that we have," and she was so excited, you know. And then when you think about it, I mean, the skin encompasses everything that we are. And when you've got a problem with the skin, so, you know, October being Eczema Awareness Month, how involved did you become with eczema, and not just the health of the skin, but the diseases of the skin?
Yeah, no, you're absolutely right. The skin is your largest organ. It has very important functions. You can't live without it. It's important for water balance, temperature control. It has its own immune system. It shields you from germs and the environment. So it's really important in the roles that it does, and it protects the entire body. So when the skin isn't healthy, the rest of you is at risk. And when you have a chronic condition, it doesn't just affect your skin and overall health, but it can affect your mental outlook as well. And when we look at things like atopic dermatitis and other chronic conditions, we also see association with depression and anxiety. So we really have to be very broad in how we take care of our patients and try to help them control it, not just think of it, oh, it's just another skin condition, and well, it's nothing important. It actually is really powerful and important. And what I love about this survey that was done by Harris Poll is that in looking at adults with moderate to severe atopic dermatitis, and this is looking at over 500 people that matched the general population, we could really see on a psychosocial level how powerfully it negatively impacted their life, and it tells us that we need to do more to help these patients.
Well, for our listeners who may not be that intimately aware of atopic dermatitis, what is it? Is it a form of eczema, or is it something that stands alone?
Atopic dermatitis is a chronic form of eczema. It can happen at any age and affect any part of your body. It's what I call a rash. It's an itch that rashes. So a lot of rashes start out as a rash, and the rash may itch. But in the case of eczema or atopic dermatitis, what you feel first is a horrible itch that can also burn, and there's no resisting scratching it. Once you scratch it, the rash starts to come out. The skin can sting and burn and turn very red and thick, and can even ooze and have crusting. It's unsightly. It can happen on different parts of the bodies at different times. We see different patterns in different ages. Not everyone, sometimes you outgrow it, sometimes you grow into it. It can be worse at different times of year. So people have their own personal triggers, but there are specific patterns that we see as well, that we see based on certain ages and immune patterns. So, and that's the other thing, is that this is an immune condition. So we're looking to understand the pathways that trigger it, and looking at more important and helpful direct ways to help target it and control it with as few side effects as possible. And part of the problem is that our basic treatments have been immunosuppression, meaning by turning off that pathway that leads to that itch, that leads to the scratch, that leads to the rash, we can try to get ahead of it. But we're really just masking it and hoping for the best. And everything has a side effect. So a lot of times patients either don't tolerate it or they give up because they don't have adequate response. And it makes it difficult for them to stay compliant.
Have you noticed any differences in these patterns that you speak of? We talked about many different aspects, age, and I'm assuming maybe environment. What about gender? Do you see an incidence more in men or women, or maybe young boys and young girls?
No, it happens in both men and women. It can happen in any ethnicity, in any age group. So, yeah, we see it broadly across populations. But because there is a genetic component of it, we do see it tending to run in families as well.
So there are genetic markers. Are there things that can be done to prevent the condition?
No, there's nothing in that way. It's just a matter of if you know it's in the family, then you know that you may be more prone to it. It doesn't, just having it in the family doesn't guarantee that you'll have it.
Okay.
And it isn't something like a genetic marker where you would basically go through IVF. I mean, there's things that you really don't want to have that baby because they'll have deformities or whatever. This is something that you just have to be aware of that can run in a family, and you need to try to be optimized in your overall health in order to try to minimize the triggers. But there's no other way at this point to avoid it or to genetically cure it.
What would you say to some healthcare providers that are listening when it comes to dealing with a patient who may be suffering from atopic dermatitis? We talked about some of the psychosocial aspects of it. Is there a large stigma? Are there things that prevent a patient from being maybe honest or even going to seek help until it's extremely affecting their lives?
Patients often give up on seeing doctors for it because they've tried lots of treatments in the past and feel that there isn't anything that's going to really help them. And they resort to either homeopathic treatments or things that are otherwise destructive but make them feel better. I've seen patients like put scalding hot water on it or just rip their skin apart because it feels so good to scratch. They just give into it and they know it's making it worse, but in the short run, they feel better. So I think for health professionals and for doctors taking care of patients with atopic dermatitis, at least the adult patients with the moderate to severe uncontrolled atopic dermatitis, I think it's really important to understand how powerfully it's affecting their lives. So if we look at the survey, about 75% of people in the survey said they scratched 3 or more times a day. 82% said that they made lifestyle modifications, meaning they wouldn't go on dates or wouldn't even want to be in pictures. And more than a quarter of those surveyed said they had 10 or more sleep disturbances due to their atopic dermatitis over the past month. A quarter of them felt they had depression, and just about a third, said they felt more anxious. So these are really powerful numbers. And what we have to do is understand those numbers are statistically across a range, but for that person sitting in our office, to them, they have their own individual, unique story. And we need to listen to that story and try to help them directly by understanding what their triggers are and the best ways they can modify those in order to work on what they have control over. So they don't have control over the fact that they have this condition. Right. That's not their choice. This is just something that happens. But we can try to help them understand by, thinking about what they tell us in that moment, what they choose to tell us as is going on in their life or how it affects them. By listening carefully and listening kind of between the lines and between the words, we can often make a very big difference, even just by being empathetic and guiding them in the best ways to manage their condition. And I think that's what makes us true healers rather than just prescribers.
You've been listening to Health Professional Radio. I'm your host, Neal Howard, in studio with Dr. Doris Day, board-certified dermatologist, discussing atopic dermatitis during October, which is Eczema Awareness Month. It's been great having you here with us today, Doctor.
Great. Thank you so much for having me.
Thank you. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm, and you can subscribe to this podcast on iTunes.